Welcome to the WRAL Daily Download. I'm Elizabeth Holmes. At midnight on October 1st, the federal government officially shut down. It happened after Congress failed to reach a deal on funding, and a big reason why is over health care. Healthcare spending is also the focus of a different budget fight here in the state legislature, and we want to know why. WRAL State Government reporter Will Doran is here to answer those questions. Will, thanks for joining us.
Hey, Elizabeth. Nice talking to you.
So, even before the government shutdown, there was a lot of finger-pointing from both Democrats and Republicans on why there would likely not be an agreement on a spending package. And so much of that has been centered around health care coverage for Americans. Tell us a little bit about that.
Yeah, so there's obviously lots of different pieces to this shutdown, but really the main reason why we're doing this right now is Obamacare. The subsidies for Obamacare that started years ago back during the pandemic are running out. And Republicans would like those to run out so that the government spends less, so that we can focus more on tax cuts, which was obviously a huge part of Donald Trump's campaigns for president every time that he's been elected, and something that he has delivered on since being in office. So they think that it's good policy, it's what people want, to have these subsidies go away. But once those subsidies go away for the 22 million people on Obamacare around the country, including about 1 million people here in North Carolina, their monthly costs are going to skyrocket. I mean, people could be paying well over $1,000 a month if they're on Medicare. And a lot of people could lose coverage entirely because, you just can't afford that. And so like I said, around basically 1 in every 10 North Carolinians could be directly affected by this. Democrats have been trying to get a deal, and they think that by essentially forcing this shutdown, it'll work out in their favor, that they can pressure Republicans into agreeing to some sort of deal, because there are some Republicans who don't want to see those subsidies go away. Some of them do, some of them don't. But Democrats think that there's enough Republicans who are on board with keeping those subsidies to make this shutdown worthwhile and save some people some money in the long run by getting those subsidies back into place.
So it seems like Democrats are taking a very big bet on essentially standing up to Republicans over these cuts that you just mentioned. That bet now means cuts to the federal government. And obviously a lot of things will be impacted by this. Maybe give us a few big hitters that people need to be looking out for.
Exactly. Federal government shutdown doesn't mean that the government is 100% shut down. Our military is still going to be active, although their paychecks might be delayed. Or will be delayed, but other programs like, SNAP and WIC, food stamps, more commonly called, those could be delayed. People who need to deal with the Social Security office for things, those could be delayed. People who want to go to a national park on their vacation, that might be shut down when they get there. So there's also concern. There's a lot of federal government workers who work at airports, for instance, and those are essential workers. They are supposed to still be coming to work, but we've seen in past government shutdowns that they have done sick outs, called in sick en masse to protest essentially against the shutdown. And so there could be a lot of domino effects here. And yes, exactly. The Democrats are taking a bet, hoping that this gets resolved quickly, because obviously the longer that this lingers, the more delays. There are more and more people are going to get affected, become annoyed by this. But I spoke to some Democratic lawmakers today, and they said that they hope that this is going to be resolved by next week. Now, of course, hope springs eternal. We'll see if that actually happens and if they actually get what they want. But that is where they're at now. But yeah, certainly taking a risk that voters won't punish them for this.
Mm-hmm. And Republicans are kind of saying, let's open up the government first, and then we'll talk about it. Meanwhile, you have Democrats that are saying, let's talk about it now, and then we'll open up the government.
Exactly.
You've kind of mentioned how North Carolina lawmakers are responding to this federal government shutdown. What is the general response, I guess? How has that been?
Well, it's very partisan so far. You talk to Democrats and they say this is entirely the Republicans' fault because they refuse to engage in good faith discussions with us about trying to save people some money. And then you talk to Republicans and they say, well, this is entirely the Democrats' fault because they are trying to hold the government hostage to get this more money for Obamacare. So the posturing right now is very aggressive on both sides, very partisan. people don't really seem like they are in the mood to come together in the same room and reach a deal and make some negotiations. But we could see some differences, particularly in the Senate. The House is pretty divisive, but the Senate tends to get along a little bit better. So if the Senate can make some headway on a deal, come together on something, the House might get in line and go along with them. And I think that's what a lot of the D.C. reporters are watching and looking for, that basically if there's going to be a deal, it's probably going to happen like that. And, maybe something gets worked out over the weekend. But right now the House isn't even in session. They've just all gone home. So we, a deal could still be a bit off.
We're going to take a very quick break. And when we come back, we're going to talk about another healthcare fight that's happening right here in North Carolina. All right, we're back. So while all of this is going on at the federal level, there's also a budget fight happening right here in North Carolina that is also centered around healthcare, Medicaid specifically. What's going on there?
Yeah, the dynamics of this are a little bit different politically, but the end result is basically the same. Here in North Carolina, Democrats don't really have very much power in the legislature. It's almost entirely Republicans making the decisions. And Republicans have failed to reach a budget deal. The new budget year started in July. It's now October. Still no budget. And really no budget even close to being in sight. And one casualty of that has been the state's Medicaid program. When we don't have a budget in North Carolina, we don't shut down like the federal government does. What we do is we just keep operating, but on the last year's budget. And so the Medicaid program has grown, but it's still operating on an outdated budget. They don't have enough money. And so October 1st was kind of the rollover date for those Medicaid funds. And now that has come and gone. They haven't come back to pass a mini budget to fix that Medicaid funding, even though, honestly, all sides agreed that it does need to be fixed. The Republicans agree, the Democrats agree, everyone agrees that it doesn't have enough money. There just hasn't been the will to actually put that money into place. And so that isn't going to directly mean that people on Medicaid in North Carolina don't get to go to the doctor anymore. But what it means is that doctors and hospitals are going to get less money for treating them. And, people respond to incentives. This is a, capitalist economy that we live in. And doctors and hospitals might say, well, if we're not getting as much money as we used to for Medicaid, which, by the way, is less money than they get anyways from treating people with private insurance, then maybe we're going to focus more on trying to find patients with private insurance, not do as many patients on Medicaid. And that could have this sort of trickle-down effect where if you are one of those 3 million North Carolinians who's on Medicaid, nearly a third of the population, it could become much more difficult in the coming months to find a doctor, get a doctor's appointment, get treatment, unless the legislature does come back soon and fix this.
And that makes me think of, especially being here in North Carolina, rural healthcare facilities where a majority of their patients may rely on Medicaid. What happens to them?
Yeah, no, that is an excellent point because you can look at the data and you see that actually in North Carolina, it is people in rural areas who are much more heavily reliant on Medicaid for their health insurance than in the urban areas. A place like Wake County might have, 10% or less of its residents on Medicaid, where, you look at parts of eastern North Carolina, farming communities. It might be 40+% of the population is on Medicaid. And so, yes, these rural hospitals are already facing, obviously for decades, they've been facing economic headwinds. And a lot of times, these are the biggest economic drivers in a county, biggest employers, some of the most stable jobs and high paying jobs around. And they're already facing trouble if they're, taking on, additional budget cuts, even if it's only, 3 or 4% in some cases, they're still not always operating on the biggest margins. That could definitely hurt some of those areas. And then there's, of course, more, issues looming with Medicaid at the federal level. Hasn't, come into play yet, but with President Trump's budget that just passed this summer, in several years, that's probably going to lead to the end of Medicaid expansion in North Carolina, which is going to kick about 670,000 people off of their insurance, again, largely in rural areas. And so, there's just all of these kind of effects. Like I said, those cuts aren't coming for several years. The more immediate issue is the the state lowering the rates that it pays to doctors and hospitals, and what kind of effect that might have on delays for people getting treatment.
Well, what do you think will happen first? You've kind of already mentioned this, but do you think we might get a budget agreement here in North Carolina or an end to the government shutdown?
Well, that is a very good question. And with the state budget negotiations, we probably aren't going to get a real budget for several months, but they could come back and do a mini budget. They were back in session just a couple of weeks ago, and they were real close to coming to a deal on Medicaid funding, and they got caught up on a completely different argument over how much money we should put into a new children's hospital that's being built. And that disagreement just killed the Medicaid talks. And so they're coming back at the end of October. They could decide to put that other fight aside and just deal with this Medicaid problem. I think a lot of people are hoping that the federal government is still not shut down by late October, but I suppose it's always possible, especially if both Democrats and Republicans are really willing to dig in their heels. But in a few weeks, both sides are at least going to have the chance to resolve some of these differences. It's never pleasant, even when it lasts for more than a couple of days. And the most recent one was years ago. It was during President Trump's first term in office. But they do come up every few years, and it remains to be seen. One, what kind of economic impact it will have, but also two, what kind of political impact it'll have. Looking ahead to the 2026 midterms, if voters decide to reward or punish one particular party for whatever ends up happening with this government shutdown here, and whether it lasts just a couple days or a couple weeks, a couple months, yet to be seen.
All right. Well, Will, thanks for chatting with us today, and thank you for listening. If you've listened to this podcast on WRAL.com or the WRAL News app, you can also find it in Apple Podcasts, Spotify, or anywhere you listen to podcasts. Follow the show so you don't miss an episode. Thanks for listening.